Now, the World Health Organization is advising men who have sex with other men to reduce their number of partners in order to limit the spread of the monkeypox virus. 98% of monkeypox cases are in men who have sex with men. Now, 18,000 cases have been reported now in 78 different countries, mostly in Europe, and there have been 5 deaths as a result of this. Let's bring in Peter ChinHong, who is a professor of infectious diseases. Peter, thank you so much for joining me. I'm wondering if you can just help me with this one. Do we know why gay men in particular are more at risk of this?
Well, Victoria, I think we had the perfect storm of 2 seminal events in Europe, and lots of people from all over the world happened to be in this community. They went to their communities and their countries, and then it was further amplified by certain events like pride events. It happened to be the right timing, pool parties, and so on. So if you can imagine, it was like a bunch of little monkeypox bombs going off in different communities. It happens to be in this community, but it's not exclusive in terms of biology. We know that in 2003, for example, in the US, it afflicted mainly prairie dog pet owners.
Yeah, exactly. So I think it's important to clarify that, isn't it? That there is no sense that only one community can be affected by this, and also that monkeypox has not been classified as a sexually transmitted infection.
No, I think it's important to make sure that people know it's not a typical sexually transmitted infection. You can get it that way, but in fact, the most common way in this particular outbreak is skin to skin. It's the same way as saying you can get giardia through sexual contact, which you can, but the main way you get that diarrhea is from drinking water from contaminated streams.
Are you seeing any stigma associated with this disease?
Yes, we're beginning to see a little bit of that. For example, today I had a patient coming in requesting treatment for monkeypox because she hugged a gay man, and there wasn't any evidence that the man had any rash or was even diagnosed with monkeypox. But I think she was fearful that the particular redness on her skin was because of that association. So I think the longer it stays, there's always that potential. Of course, we have a lot of lessons from the HIV epidemic. So people are being very delicate about the messaging and, how we navigate this.
And to the point about treatment, how easy is it for people to receive treatment across the world? How patchy or how good and well covered are people for dealing with this?
I think it's very, very inequitable right now. There are some criterion for treatment. We don't have randomized controlled data, but there's some case series and some animal studies that look good. And in my experience, many patients have done well, but even in California, where there are some centers, it's very unequally distributed amongst the state. I got an email 2 nights ago from a patient in Alberta, Canada, because he saw a report from one of my patients who received treatment, and he was wondering how we can get it. We've even gotten calls from Colorado and Los Angeles, far away. So it's really, really tough, I think, for people with serious symptoms. And we're hoping, and a lot of people are petitioning, and the CDC has tried to lower the barriers for treatment, but it's still an investigational drug. So it comes with that paperwork and time you need to process it.
Peter ChinHong, thank you very much for your time and your analysis, Professor of Infectious Diseases. Thank you.